All right, so welcome back, everyone. We're going to start back on page 1064 with the patient assessment of abdominal injuries. Assessment of abdominal injuries is one of the more difficult assessments that you will perform because causes of injury may be apparent, but resulting tissue damage may not be so apparent. Patients may be overwhelmed with other more painful injuries, and some abdominal injuries develop and worsen over time, making reassessment critical. So we always want to follow the same steps as we do in all our other assessments. We start with scene size, of course, BSI, make sure your scene's safe. Call for additional resources if needed, and you want to observe the scene for early indicators of the mechanism of injury. All right, page 1065 under primary assessment, we first want to perform a rapid scan. And this will help establish the seriousness of the patient's condition. Some abdominal injuries will be obvious and graphic, but most will be very subtle and go unnoticed. Then you want to form a general impression. Important indicators will alert you to the seriousness of the patient's condition. Trauma patients with closed abdominal injuries may have what appear to be minor injuries, but you should not be distracted from looking for more serious hidden injuries. All right, then you want to check for responsiveness using the APU scale. You'll provide high-flow oxygen via non-rebreather mask to all patients whose level of consciousness is less than alert and oriented. And unresponsiveness may indicate a life-threatening condition. In trauma patients, life-threatening external hemorrhage must be addressed before airway or breathing concerns. All right, under airway and breathing, ensure that the patient has a clear and patent airway. If a spinal injury is suspected, prevent that patient from moving. And clear the airway of vomitus so it is not aspirated into the lungs. A distended abdomen may prevent adequate inhalation. So providing supplemental oxygen will help with oxygenation. All right, on circulation, superficial abdominal injuries usually do not produce significant external bleeding, but the internal bleeding can be profound. Trauma to the liver, kidneys, and spleen can cause significant internal bleeding. So you want to evaluate the pulse, skin condition, skin color, temperature, and condition to determine the stage of shock, and treat aggressively if the patient is in shock. Then of course, you want to make your transport decision. Abdominal injuries usually indicate a quick transport to the hospital. And a patient with abdominal injuries should be evaluated at the highest level of trauma center available. All right, turn over page 1066. You want to investigate, on a history taking, you want to investigate the chief complaint and MOI. Also identify associated signs and symptoms and pertinent negatives, and note the position in which the patient is lying. Movement of the body or the abdominal organs irritates the inflamed peritoneal, causing additional pain. To minimize this pain, patients will lie still, usually with their knees drawn up. All right, and going back to page 1066, look where it says, right there above history taking, where it says abdominal pain together with MOI that suggests injury to the abdomen or flank is a good indicator for rapid transport. Highlight that. And right below that, treatment should be directed at quickly addressing life threats and provide rapid transport to the nearest appropriate hospital. Go ahead and highlight that. All right, back under history taken, under sample history, you want to use your OPQRST to help explain abdominal injury and ask the patient if he or she has experienced any nausea, vomiting, or diarrhea. Ask about the appearance of any bowel movements and your urinary output, and determine if there was any blood in the urine or black or tarry stool, which is melena. All right, under secondary assessment on page 1066, you may not have time to perform this detailed comprehensive exam in critically injured patients. So you want to do a physical examination. You want to remove or loosen clothing that expose injured regions of the body. Inspect the patient for bleeding before removing the clothing to prevent damaging exposed tissues. And you want to provide privacy or perform in the back of the ambulance. Patients should be able to stay in position of comfort unless a spinal injury is suspected. You want to place the padding on the knees of the patient with a suspected spinal injury and can worsen pain if you are too aggressive. And you may find your patient in a fetal position because that may be the position of most comfort. All right, you want to examine the entire abdomen, including all posterior, anterior, and lateral surfaces. This is a critical step for patients with an entrance wound. And you want to always use DCAP BTLS to help identify specific signs and symptoms of injury. You want to inspect and palpate the abdomen for presence of deformities. Look for the presence of contusions and abrasions. Puncture wounds and other penetrating injuries cannot be overlooked. You want to note the presence of burns and palpate for tenderness and attempt to localize a specific quadrant of the abdomen. And treat lacerations with appropriate dressing. And swelling may involve the abdomen globally and indicate significant intra-abdominal injury. All right, then you want to palpate the abdomen when examining that region. You want to start by palpating the quadrant furthest away from the quadrant that exhibits signs and symptoms of injury and pain. This allows you to investigate the possibility of radiation and extension of pain into other quadrants. You want to perform a full body scan to identify injuries other than abdominal injuries. So you want to begin with the head and finish with the lower extremities, moving in a symptomatic manner. If you find a life threat issue, stop and treat it immediately. Inspect and palpate the kidneys area for tenderness, bruising, swelling, or other signs of trauma. Hollow organs will spill the contents into the peritoneal cavities. These injuries will typically present as diffuse pain with guarding and reaction to sudden jarring movements. All right, and on page 1066, where it says on the second paragraph, first part of the second paragraph, where it says kidneys are located in the flank region of the back. Inspect and palpate this area for tenderness, bruising, swelling, or other signs of trauma. Go ahead and highlight that. All right, you want to also obtain vital signs. Many abdominal injuries can cause rapid pulse and blood pressure. You want to record vital signs. Your record of vital signs will help you identify changes in the patient condition. All right, start on page 1069 of reassessment. You want to repeat the primary assessment and vital signs and reassess the interventions and treatment you have provided. Under interventions, you want to manage airway and breathing problems based on signs and symptoms found during the primary assessment. Provide complete spinal mobilization. If the patient has signs of hyperfusion, provide treatment for shock and rapid transport. If visceration is found, place a saline moistened dressing over the wound and transport immediately. Never attempt to push eviscerate tissue or organs back into the abdominal cavity. A patient with a ruptured diaphragm may have an abdomen with a sunken anterior wall. And you look over on page 1069 of reassessment, go ahead and highlight that. That is in the second paragraph. And these patients should receive positive pressure ventilation with a bag valve mask. All right, and lastly, under reassessment, communication documentation. Communicate all relevant information to the staff at the receiving hospital. And it is imperative that you are able to describe the scene in enough detail to give the trauma team a clear idea of these circumstances. Be cautious and diligent when dealing with patients who refuse transport after sustaining an injury to the abdomen and genitourinary system. These patients are at high risk for complications. All right, moving down under emergency medical care of abdominal injury, page 1069. Starting with closed abdominal injury, the EMT's biggest concern is not knowing the true extent of the abdominal injury. These patients require rapid transport to the nearest and highest level of care, primarily to a trauma center with a surgeon. And you want to position the patient for comfort, apply high flow oxygen if the patient has signs of hypoxic shock, and you also want to treat for shock. A patient with blunt abdominal wounds may have severe bruising of the abdominal wall, liver and spleen laceration, rupture of the intestine, tears in the mesentery, rupture of kidneys or avulsion of kidneys from the arteries and veins, rupture of the urinary bladder, severe intra-abdominal hemorrhage, and peritoneal irritation and inflammation. A patient with a blunt abdominal injury should be log rolled to a supine position on a backboard. And you want to monitor the patient's vital signs for any indication of shock and treat appropriately. All right, turn on page 1070. Under open abdominal injuries, patients with penetrating injuries, generally obvious wounds and external bleeding. However, significant external bleeding is always not present. You want to maintain a high index of suspicion for serious unseen blood loss. Only a surgeon can accurately assess the damage. You should assume the object has penetrated the peritoneal and possibly injured organs. Follow the general procedures described previously for care of a blunt abdominal injury, as well as inspect the patient's back and sides for an entrance wound. You want to apply a dry sterile dressing to all open wounds. If the penetrating object is still in place, apply a stabilizing bandage around it to control external bleeding and to minimize the movement of the object. Severe lacerations of the abdominal wall may result in evisceration. And again, never try to replace a protruding organ. You'll remember to keep the organs moist and cool and cover one with a moistened sterile dressing. Secure the dressing with a bandage and secure the bandage with tape. All right, and under abdominal evisceration, if you'll go ahead and highlight where it says never try to replace an organ that's protruding from a abdominal laceration. And then highlight where it says instead cover it with sterile dressing, moisten with sterile saline solution, and secure with a bandage and tape. And lastly, go ahead and highlight where it says you must keep the organs moist and warm. Highlight all those. All right, page 1072 under anatomy of the genitourinary system. The genitourinary system controls reproductive functions and waste discharge. Organs of the genitourinary system are located in the abdomen. Kidneys are solid organs. Ureters, bladders, and urethras are hollow organs. All right, moving on to page 1063, injuries of the genitourinary system. Starting with kidney injuries. These injuries are rarely seen but not unusual because kidneys lie in a well-protected area. A forceful blow or penetrating injury is often involved, and less significant injuries can result from an indirect blow or even a football tackle. And you want to suspect kidney damage if the patient has history or physical evidence of any of the following: abrasion, laceration, or contusion of the flank, a penetrating wound in the region of the flank or upper abdominal area, fractures on either side of the lower rib cage or of the lower thoracic or upper lumbar vertebrae, or hematoma in the flank region. All right, injuries to the urinary bladder. It may result in urine spills to the surrounding tissues. Blunt injuries to the lower abdomen or pelvis can cause rupture to the urinary bladder, particularly when the bladder is full and distended. In males, sudden deceleration from a motor vehicle or motorcycle crash can shear the bladder from the urethra. In later trimesters of pregnancy, bladder injuries increase from displacement of the ureters. On page 1064, injuries to the external male genitalia are usually soft tissue wounds. They are painful and of great concern for the patient, but rarely life-threatening. And they should not be given priority over more severe wounds unless there is significant bleeding. All right, female genitalia injuries. The internal female genitalia, the uterus, ovaries, and fallopian tubes are rarely damaged. That's because they are small, sit deep in the pelvis, and well protected. Exception is the pregnant uterus. Uterus enlarges substantially and rises out of the pelvis. And injuries can be serious because the uterus has a rich blood supply during pregnancy. Also keep the fetus in mind. In the last trimester of pregnancy, the uterus is soft and may obstruct the vena cava. The female's blood pressure may decrease, so these patients should be placed on the left side so the uterus will not lie on the vena cava. All right, the external female genitalia has a very rich nerve supply, so injuries are very painful. You want to consider sexual assault and pregnancy. Always ask these patients about their last known menstrual period. Ask about sexual history. Assume all women of childbearing age are possibly pregnant. This information is relevant because some medication and tests are harmful to the fetus. In case of external bleeding and trauma, a sterile sorbent sanitary napkin or pad may be applied, but do not insert instrument, glove fingers, or tampon into the vagina. It can cause further damage. All right, patient's assessment of the genitourinary system, page 1075. All right, there's always a potential for patient embarrassment. So you want to maintain a professional presence. Provide privacy during the assessment. And when possible, have an EMT of the same gender to perform the assessment. Then you want to look for blood on the patient's undergarments and only inspect the external genitalia when there are complaints of pain or external signs of injury. And that is the last sentence under a patient assessment of the genitourinary system, so go ahead and highlight that. All right, and the assessment steps are the same. BSI, same size up. The mechanism of injury, natural illness. You want to look for indicators of the MOI and consider how MOI produced the injuries expected. Some patients may avoid discussion to avoid undergoing a physical exam. Patients may also provide an MOI that seems less embarrassing than the actual MOI. All right, under primary assessment, page 1076, you want to quickly scan the patient to identify and treat any life threats. The genitourinary system is very vascular. injuries can produce a significant volume of blood. So do not void this area in a rapid scan. If bleeding is present, maintain privacy for the patient and inspect exterior genitals for visible injury. And remember, life-threatening hemorrhage must be addressed immediately. All right, then you want to form general impression. Then moving on down to airway and breathing, you want to ensure the patient has a clear and patent airway. If the patient is unresponsive or has significant altered level of consciousness, consider inserting an OPA or an NPA. All right, then, on circulation, genitourinary system can be a significant source of bleeding. So you want to assess pulse rate quality, determine skin condition, color, and temperature, and check capillary refill time. Closed injuries do not have visible signs of bleeding, so shock may be present. Assessment of pulse and skin will indicate how aggressively to treat for shock. And you want to control bleeding if visible bleeding is seen and significant bleeding is a life threat, and again must be controlled quickly. Make your transport decision. Any injury to the genitourinary system can be life-altering. All right, under history taken, you want to investigate the chief complaint. Common associated complaints with genitourinary injuries are nausea and vomiting, diarrhea, blood and urine, vomiting blood, and abnormal blood and bladder habits. All right, then moving on down to the sample history. Of course, you want to use OPQRST to learn about the patient's pain. Ask the patient about any output from the genitourinary system, especially about blood in the urine. The importance of past medical history cannot be overstated. Repeated or previous injuries or illnesses can help determine the extent of the current injury or illness. Last intake of food or fluids is important because it can predict the genitourinary system contents. And always address the events leading up to the injury. All right, under secondary assessment, page 1077, physical examination, genitourinary system injuries can be awkward to assess and treat, so privacy is a genuine concern. When the patient has an isolated injury, focus on that and the body region affected, and then you want to look for DCAP BTLS. Identify wounds and control bleeding. For significant trauma, start with a full body scan to see if there is trauma affecting multiple systems. Then you want to obtain patient's vital. The patient's vital signs. It is important to reassess vital signs to identify how quickly the patient's condition is changing. Signs such as tachycardia, tachypnea, low blood pressure, weak pulse, and cool, moist, and pale skin indicate hypoperfusion. And you want to evaluate the need for rapid transport. All right, on the reassessment, you want to repeat the primary assessment and vital signs. Reassess the interventions and treatment you have provided. And under interventions, you want to provide oxygen if there are signs of dyspnea or shock, and maintain a patient airway. Attempt to control bleeding and treat for shock, and place patient in position of comfort and transport. All right, then lastly, under communication and documentation, communicate your concerns to the hospital staff and describe all injuries and treatment given. All right, page 1077. Emergency medical care for genitourinary injuries, starting with the kidneys. Damage may not be obvious upon inspection. However, you will see signs of shock. You may see blood and urine. So you're going to treat for shock, transport properly, and monitor vital signs en route to the hospital. Urinary bladder, suspect a urinary bladder injury if you see blood and urethra opening. Signs of trauma to the lower abdomen, pelvis, or peritoneal. If shock or associated injuries are present, transport promptly and monitor vital signs en route. All right, external male genitalia, I'm going to leave that to your reading pleasure. But I do want you to notice the 5 general rules concerning treatment of injuries involving the external male genitalia. Especially number 3, where it says apply direct pressure with dry sterile gauze dressing to control bleeding. Go ahead and highlight that. And then under female genitalia and rectal bleeding, I want to leave that for your reading pleasure. But under female genitalia, at the top left of page 1079, where it says under no circumstances should you pack or place dressings into the vagina, go ahead and highlight that. And lastly, page 1079, sexual assault. Sexual assault and rape are all too common. Victims are generally women, sometimes men, and children are victims. Often there is little you can do providing for compassion and transport. The patient may sustain multi-system trauma and you may need to treat for shock. All right, do not examine the genitalia unless obvious bleeding requires application of a dressing. And you will see that in the first paragraph on page 1079. Go ahead and highlight that. Then go ahead and highlight the second paragraph where it says advise the patient not to wash, bathe, shower, douche, urinate, or defecate until a physician has examined him or her. Highlight that. And lastly, highlight where it says handle the patient's clothes as little as possible, placing articles or any other evidence in paper bag. So that will conclude our lecture on chapter 30. So until next time, stay safe and God bless.